So like I mentioned earlier on, restaurants are being partially reopened. Of course, there's stringent rules. One, they have to operate between 5 a.m. and 4 p.m. All the workers have to be tested. There needs to be a 1.5-meter distance between one customer and the next, all right? There's been a lot of reaction on this. Good timing, good idea, bad idea. Let's talk to the people who own restaurants. And we are crossing over to Eldoret, where John Wanyama is standing by. Wanyama, good morning. It's good to see you. What are the people there saying? Is this a good time or a bad time?
A very good morning to you, Trevor, and in Uasin Gishu, residents are feeling like it's not the right time for the hotel to have been opened. But since the minister said that they have allowed hotels to open, I can tell you that the population has grown a bit bigger in towns now that earlier than that what was seen before the hotels were open. But where I'm standing at Sam's Hotel, where this guy is just a hawker in town, and he had just started developing this place, a hotel. And when he was just starting to realize what he was doing, now this curfew and the business hotel was locked down. Let's talk to Josephat Kashohi, the owner of this hotel, Sam's Hotel. Kashohi, habari asubuhi, na pengine unaonaje kufungua kwa hoteli kufikia sasa? Unaona ni wakati mwafaka wa serikali kufungua hoteli?
Yes, kwa majina yangu ninaitwa Josephat Kashohi, mfanyabiashara hapa Uasin Gishu. Kwa maoni yangu mimi ningeona kama sio wakati mzuri, na kama ingekuwa ni wakati mzuri pia serikali haingeweka masharti ambayo yameweka ya kusema wafanyikazi lazima wapimwe. Kwa sababu yenye nasema hivyo ni kwa sababu jana nilituma one of my worker hapa aende kule hospitali apimwe, lakini wakati alipofika kule akaambiwa ya kwamba kama hana dalili za huu ugonjwa hawezi pimwa. So nikaona ni kama serikali imefungua hoteli na mkono nyingine haijafungua, kwa sababu ingekuwa imeweka hili jambo kuwa ni wazi ya kwamba ukiwa mfanyikazi wa hoteli, so long as umeenda na medical ya kusema wewe ni mfanyikazi wa hoteli, unapimwa ili ukuje urejee kwa kazi. So ni kama kwangu mimi naona kazi ya hoteli haijafunguliwa, kwa sababu saa hizi tunapoongea hapa sijafungua kwa sababu wafanyikazi wangu hawajapimwa hii COVID-19. Na ninapofungua huu mlango, polisi definitely watakuja hapa. Ile kitu watafanya ni kuuliza kama wafanyikazi wamepimwa. So siwezi fungua mpaka wakati wafanyikazi wangu watakapopimwa, kwa sababu mimi kwangu hoteli hazijafunguliwa. Yes.
And maybe kuna ile idadi ya wateja ambao pia wamesema iwapo utafungua watapungua. Itakuadhiri vipi?
Itatuadhiri sana, kwa sababu kazi ya hoteli huwa tunapika chakula tugoje wateja. So kama wateja hawawezi kuja, kile chakula kitakuwa cha kutupwa. So kwangu mimi nitakuwa nimeenda hasara, kwa sababu zile chakula nimenunua zikuje zipikiwe watu na hawajakuja. So licha ya kuwa nimefungua huu mlango na wateja hawajakuja, ningali bado usifanye kazi yoyote. Yes.
Pengine wewe kama hoka ambaye kwa sasa una loan inakusumbua kivipi, na ndio ulikuwa umeanza hii hoteli, ukimalizia tu?
Yes, kwa hakika tuko na masumbuko mengi na sijui serikali itafanya nini, kwa sababu jengo kama hili nilikuwa limenianzisha tu juzi, wakati nilipokuwa nimeona kwanza kazi ya kanjo kukimbizana ni kama miaka nayo inaenda ikizidi. Sasa nikasema nikuje nijaribie kazi mahali hapa. Wakati tu ninaenda kufungua, mambo hayo yakakuja na nina mkopo. So sijui serikali itafanya vipi, lakini kwa wafanyabiashara tunaumia.
Thank you, Kashohi. Trevor, there you have it. Josephat Kashohi, the owner of this Sam's Guest House Hotel. And as you have heard from him, Trevor, is that they are really suffering because they are feeling like the government has given them a go-ahead to open the hotels, but there is no one or a hospital in Uasin Gishu, apart from Moi Teaching and Referral Hospital, who are testing COVID-19. But Moi Teaching and Referral Hospital, they are only testing patients who have maybe symptoms of COVID-19, not just that you are working there, a health person, and going to take a test. Maybe you are working in a hotel so that you can be allowed to open hotels. But all private hospitals, CEOs whom we have talked to, they are saying they have already not started maybe testing patients for COVID-19, and they don't have those kits around here to start testing those COVID-19. These are just some of the side effects that maybe those who are running hotel business are going through. Trevor.
Thanks, John. That's John Wanyama speaking to us live from Eldoret. Let's take a pulse of the same situation in Kisumu. And Laura Otieno is joining us live from there to find out from them whether they are happy with this timing. Laura, good morning. It's good to see you. What are the people saying in terms of the reopening, the partial reopening of restaurants?
Well, indeed, Trevor, residents are enthusiastic. The hotel industry is also looking to try and restabilize themselves following the losses that they incurred following that partial lockdown. But then looking at how other countries have been dealing with the coronavirus, there have been some sort of temporary lifting of certain restrictions, and therefore Kenya is looking like it's playing to the tune of other countries in the world. Perhaps just to get it straight from the horse's mouth, I am here with a manager of one of the leading hotels in Kisumu. Welcome to Citizen TV. Please face that direction and tell us, how practical is it for you, because you're required to test all your staff? Do you have the financial muscle to ensure that is achieved?
That is going to be very tricky, because one thing that I know is testing an individual costs about 10,000 shillings, and they've got 80 staff. It will mean 80 times 10,000, that's about 800,000 shillings, is already a strain on the, because we've actually sent this staff away on a very minimal pay, which we are trying to scoop out of whatever we had already made to pay them in terms of salaries. So the government has got to come up with a mechanism in supporting the industry in the testing of the staff. And they should also tell us, how are the staff going to be tested? Because are they going to bring somebody to the hotel and test all the staff, or are they supposed to go to a particular center for testing? This needs to be made very clear, because we are all confused with regards to that. Yes.
And in terms of training your staff now, because social distancing is also something that is taken as general precautionary measures, will you be testing your staff so that waiters will be observing the 1.5-meter social distancing when serving the people that are coming in?
Again, that's a challenge, because what we are doing before the guests come in, we are going to have somebody at the gate testing all the guests who are coming in with regards to the temperatures and also the sanitization. So if the temperatures are okay as per the government's regulation, it means that this person should be okay. Now, serving a guest, maintaining the social distance of 1.5 meters is going to be a challenge, because one way or another, you'll have to get closer to that guest. But because we are also going to provide the masks, then the challenge will just have to be there. We'll just have, the waitresses or waiters will just have to be a little bit closer so that they can be able to serve the guests. Yes.
Well, indeed, Trevor, that is a manager of one of the hotels, and he's raising some very pertinent questions on how exactly is it practical for restaurants to be observing the social distancing rule. And of course, there is an issue that the Ministry of Health has been pointing out, that some of the patients are actually asymptomatic. So you would be having the correct temperature, you would be seeming fine, but then you are carrying the virus. So of course, perhaps those are some of the issues that the hotel industry will be discussing with the ministry moving forward, to ensure that in as much as the country tries to salvage the economy, the health of Kenya assured. So of course, we'll also be looking at how other countries across the world have been lifting their lockdowns, and how the Ministry of Health will be in talks to the government to ensure that the health of Kenyans is assured in as much as we try to save the economy, Trevor.
Yeah, thanks.